Today I want to talk about healthcare literacy. What is it? Healthcare literacy is your patient's ability to understand medical information. And that ranges from appointments to prescriptions to medical information, pre-op and post-op instructions. It's estimated that $32 to $58 billion are spent on additional healthcare costs because patients do not have good healthcare literacy. A study by the Center for Healthcare Strategies was done on 483 asthma patients. And I think these statistics will scale regardless of your practice. If it's orthopedics, plastic surgery, dermatology, it does not matter. These results will scale through your practice and are irrelevant. But 483 asthma patients were studied. 40% of those patients read at or below a 6th grade level. Think about that. 40% at or below a 6th grade level. And there are legal ramifications when patients don't understand things. The FDA and JCAHO all require that a healthcare provider be able to document that the patient understands the medical information you have provided to them. That's stressful. So today I want to give you 4 tips on improving healthcare literacy in your practice. Tip number 1, 65% of the population are visual learners. Visual aids will improve patient understanding by 400%. So let's think about that. If you just tell a patient about ACL reconstruction, their comprehension will be 400% better if you have an anatomical model or an animation and combine that information with a visual. Again, 65% of the population are visual learners. Tip number 1. Tip number 2, use common words. Try and not impress a patient with your vast vocabulary for medical terminology. Chances are they don't understand it. So instead of saying something like prevents osteoporosis, say something like keeps bones strong. Little common terms and usage go a long way with patients, even regardless of their educational levels. Tip number 3 is accessibility. 80% of the population in the United States has internet access. So we've talked about visual learners. You've got animations already on your website. Hopefully they've been integrated well. You're going to use common terms and words during consultations, and you're going to have that same content in descriptions or text on your website combined with the animation. Now it needs to be accessible. So putting all this great content on your site, it's available 24/7. Patients can look at it from the comfort and privacy of their own home. And furthermore, it gives other family members a chance to also read the instructions and make sure that their loved one is compliant and understands things. So, accessibility. Put this information on your website. The 4th and final tip to improve healthcare literacy in your practice is specific to the animations. And it's something that a few practices are doing. I think it's a brilliant idea, and more should do it. And that is they're requiring that patients review the animation before they come in for a consultation. When they do come in for the consultation, the practice will have the patient put their initials on the printout. All of our animations can be printed out, by the way. Patients will go ahead and initial the printout, and the practice will put that in their folder as an additional informed consent tool. I hope these healthcare literacy tips have been helpful and you can integrate them into your practice.